Alright, so I'm going to be talking about leukemia and how it affects the oral cavity. But first, before we get to that, I want to talk about periodontal disease. So you start off with gingivitis, and that is the gum disease. It is a gum infection that there are many symptoms such as bleeding, redness and swelling, but there's no bone loss. And then as you progress into periodontitis, then there comes the bone loss, and there are many stages of that depending on how much bone loss, and that is all because of the immune response. It's not the bacteria, but it's because of the immune response to that bacteria. So how that bacteria comes around, you have thousands of types of bacteria in your mouth, and when pellicle is formed on the tooth, the bacteria start to form to it, and that is how it creates biofilm, which is a community of bacteria, and it's all living. So whenever pellicle is formed, bacteria start to attach, and some of that bacteria is some gram-positives such as the streptococcus and also the actinomycins. And then when that progresses, then you start to have some of the gram-negatives such as the fusobacterium and also the prevotella. But whenever that goes even further, then you start to have even more gram-negatives, which are worse than the gram-positives, such as the phosphor monos and the captain cytophage. And when those are all together, then with the mixture of sugars, then that creates an acid, and that's what erodes your teeth. But that is not how your bone starts to deteriorate. It's only because of the immune response. So I'm going to be talking about different things with leukemia now. And leukemia is a bone and blood cancer. It's a bone marrow cancer. And it is caused by the overproduction of white blood cells that are all abnormal, that are all cancerous. So there are two main types of cells that are affected by this: the lymphoids and also the myeloids. And depending on which ones are affected, there are 4 different types of leukemia. There's acute and chronic for both the lymphatic and also the myeloid. And acute is a lot faster and more active, and it hits so much harder. And then chronic is much slower progressing, and some people don't even know that they have it all at once. But some of the symptoms that can come with leukemia is fever, weakness, infections, weight loss that's unplanned, and also lymph node swelling, easy to bleed or bruising, and also bone pain. And sometimes you can also have tiny red lesions on your body. Those are petechiae. So some of the oral complications with leukemia include the increased periodontal risk. Patients with leukemia do have a higher risk of periodontal disease. And also there are many oral manifestations. Sometimes there's also a possible link to candidiasis, which is more of a yeast infection of the mouth. And then also gingival enlargement and oral pain and many more that can arise from leukemia. So the reason that I found that was some of the biggest influences of oral manifestations with leukemia is all the treatments that you get. The chemotherapy and also radiation therapy, and also with bone marrow transplants. Those are all complications that can have oral manifestations of many different things, such as with chemotherapy, you can have mucositis, and also oral pain, candidiasis, ulcers, and many others that can all arise from just chemotherapy. And also with radiation therapy, you can have oral mucositis, and for bone marrow transplants, you can have gingivitis and a progression of dental caries and periodontal enlargement and periodontal involvement and tooth abnormalities, especially with children. That can all change due to the different ages of the patients who have leukemia. There are different manifestations due to the age because their teeth are still developing. So that's just some of the complications with leukemia, and it's really interesting, and I hope that you knowing this, you'll be able to try to stay away from other sugary beverages, because people with leukemia are more susceptible to periodontal disease. So that's something to always look for.